Hugh Chatham Memorial Hospital in Elkin, North Carolina is doing some new exciting things with financial reform. I spoke with CFO Don Trippel to hear more about it.
Well, it was it was the whole team, the whole hospital, and expectations that they had for improved productivity. We staffed at a 90th percentile, so and everybody in the hospital understood that that was what their goal was, and they worked hard to achieve that. And we saw some additional physicians come into the hospital that brought us quite a few different patients that we'd never had before. And so that was the way we really turned it around. And our board is very financially driven and push us to maximize reimbursement and our profits. I think we've been a leader in bringing about the electronic medical record. We got meaningful use. We were the third hospital in North Carolina to receive those funds the first year. And we've just added an HD system, patient flow and throughput that really has improved some of our operations. And again, part of that has helped us improve our profitability also.
Now you say it's improved. What are some of the things that this patient flow solution has done?
Well, before we would, when we had a patient in the emergency room that needed to be admitted, they would call one of the nurse managers who took turns putting the patients in beds. They would call them. It took them a while to get hold of them, for that nurse then to figure out which bed was going to go to. The system immediately showed available beds, and so the ED could see to them right at the time of the admission process that the next bed available is this bed, so it was assigned to that bed, and it immediately deducted 25 minutes off of the time for the patient going from the ED to the bed. We've really been working with our case managers, and part of the HD system has also helped them in their process by identifying patients who are observation patients who are there for longer than a day, and so they can identify those as patients to try and move out of the hospital a little bit quicker, and also shows both them and the physicians the costs that have occurred with the patients and how much the DRG is going to pay, so they have that information available to them on a screen, so they can help them make decisions on what has to happen with the patient. Obviously the patient care comes first, but profitability is there also.